Welcome to the NCCEH Healthy Built Environment webinar, which is part of our Built Environment online discussion forum. My name is Tina Chen, and I'm a knowledge translation scientist at the National Collaborating Center for Environmental Health. So just to start, we'd like to acknowledge the land on which we're calling from within the traditional unceded territories of the Coast Salish peoples, which include Squamish, Tsleil-Waututh, and Musqueam nations. We are grateful to have the opportunity to live, learn, and work and play within this territory. So during the webinar, please turn off your webcams and put yourselves on mute throughout the presentations. You may type your questions into the chat box at any time during the webinar, and we'll get to them at the appropriate times. And today we have the great pleasure of having three speakers who will talk about their project integrating physical activity and chronic diseases health outcomes with scenario planning tools in transportation and land use applications. Our first presenter is Eric Fox, who is a senior planner with Urban Design for Health, where he is responsible for managing the development of methods, tools, and evidence to support health-informed transportation and land use decisions. Eric was integral to the development and application of a health module add-on for scenario planning tools to measure the health implications of transportation and land use infrastructure investments for Toronto public health. Recently, he also led a health equity study to integrate health considerations into regional transportation planning using the National Public Health Assessment Model for the San Joaquin Council of Governments in California's Central Valley. Eric has published several peer-reviewed articles showcasing UD4H's wide breadth in health and built environment research in journals such as the Journal of Transport and Health, Social Science and Medicine, and the International Journal of Health Geographics. Previously, he worked as a research associate for the Health and Community Design Lab at the School of Population and Public Health at the University of British Columbia. And Eric holds a master's degree in transportation and land use planning from UBC and a bachelor's degree in geography with a focus in spatial information science from Simon Fraser University. Our next speaker is Dr. Lawrence Frank, who is the president of Urban Design for Health. Dr. Frank specializes in the interactions between land use, travel behavior, air quality, and health, and in energy use and climate change impacts of urban form policies. He is a walkability pioneer and was among the very first to quantify connections between built environment, active transportation, and health. He coined the term walkability in the early 90s, and his work led to the Walk Score and has been cited over 38,000 times. He has been listed in Thomson and Reuters' top 1% in the social sciences and is the #1 top ranked planning academic in North America, according to a recent Google Scholar ranking. Dr. Frank has published over 2,000 peer-reviewed articles and reports and co-authored Health and Community Design in Urban Sprawl and Public Health nearly 2 decades ago that mapped out the field emerging at the nexus between built and natural environments and health. And last but not least, we have Christine Corrales, who is a senior planner with San Joaquin Council of Governments. Christine is a Central Valley native from Stockton, California, where she grew up, a daughter of immigrants from the Philippines. Christine is interested in social equity and public health issues as they intersect with urban planning. Prior to starting her career in planning, Christine worked for various nonprofit and community-based organizations serving communities of color. After going to school and working in large cities like Los Angeles, Oakland, and Portland, Christine returned home. Christine completed her undergraduate studies at UCLA and earned a master's degree in urban and regional planning from Portland State University. She is a senior planner at the San Joaquin Council of Governments, where she works on regional housing, regional planning studies, and community partnerships. Thank you, Eric, Larry, and Christine. Now over to you.
Yeah, and Tina, I just see there's about 47 people still in the waiting room, so I just want to make sure we can let everyone in.
Yep.
Looks like you have.
Thank you.
So yeah, thank you very much, Tina. We'd like to thank the National Collaborating Center for Environmental Health for letting us host one of these Healthy Built Environment webinar series. As she mentioned, our focus today is going to be on scenario planning and how we've been able to integrate health into these tools and use them specifically for transportation and land use applications. So I'm just going to give a quick overview of the presentation that we have in store, and then I'm going to pass it on to Christine. So we're going to mix and match the speakers a little bit here, but I would like to first start off.
Eric, I'm online.
Yeah, so I'm just I'll just pass you the presentation here. We're going to first start off with Larry giving a review of integrating scenario planning tools, health integration into scenario planning tools. And then we're going to look at these two case studies that we described, one for the West Don lands in Toronto and the other for the South Stockton Promise Zone in Central California. And then we'll have some time for discussion afterwards. So I'll pass this on to Larry to lead us forward on the next steps here.
Thank you, Eric. I had quite a odyssey getting logged on. Good morning or afternoon, depending on where you are. I'm excited to have this opportunity. Thank you to NCCEH and the Coordinating Center National. We're been at this a long time. This is a bit of an integrated talk I'm going to give. My background as both professor, I was at UBC and recently moved to San Diego to UCSD. Urban design for health has been around for a quarter of a century and has been developing these tools, really applying the research that we've been doing in the university environment to decision-making and practice. We develop evidence-based models. Scenario planning has been a method that we've been using for over a decade at bringing health into it. It is becoming a more and more adopted tool in decision-making for transportation long-range planning in the United States in particular. In Canada, there's been some usage of scenario planning. It's a simulation what-if kind of a tool that allows you to more easily make informed decisions on the fly quickly, given the incredible computing power that's now available. We are able to monetize the health impacts. So we're taking all of this evidence, I'll present a little bit on, and then build it into a decision support tool, which is so critical. Having the evidence is one thing, but being able to apply it directly in an informed and concrete way with a validated tool is really helpful and needed now that people are really wanting to move on this evidence and make decisions. We are able to measure built natural and social environment impacts on pedestrian, multimodal, green space. Basically been working in the US and Canada for quite some time. Eric, please advance. This is, there's my, and most of all, thank you to Eric for organizing this session. Basically, lots of partners, move on, in both countries. Basically, a little bit about the firm, just active transportation planning has been something we've been working on myself for a third of a century. Jim Chapman, who's with the firm 22 years and so forth. So a lot of background, and we prepare land use and transportation plans. We like to apply evidence to comp planning and OCPs, quantifying GHG and equity impacts. We perform health impact assessments using evidence-based tools. Not so much on the qualitative side only. We think qualitative is critical, but integrated with quantitative is the best, realizes the best solution. Monetization's been a key theme for us because until you can speak to the economics of the healthcare cost savings and the workforce productivity and the other aspects, you really don't have the full story, and it's hard to activate decision-making. Transportation project prioritization is critical, and we'll talk a little bit about acquiring primary data. On the right-hand side, lots of outcomes, weight-related, chronic disease, diabetes, hypertension, coronary heart disease, depressions, the stress, now we're looking at COVID-19 risk, which is tied directly to chronic disease. Got a couple of papers on that. And then active transportation, transit, and vehicle use. And then of course, cost of illness is something we work on. Next slide, please. So there are 7, we recently completed a report for the Transportation Association of Canada. Jim Chapman with UT4H led this project. And it's starting to get used, which is sort of how to integrate health into a variety of transportation decision-making contexts in Canada. We worked with ALTA, Planning and Design, close collaborator of ours. And we have 7 primary points of connection. As you can see here, multimodal transportation systems, mode choice, access to health services, mental health, reducing exposure to air pollution. So on the exposure side, not just behavioral impacts, physical activity and active travel, and maybe even sense of community, social capital, but really on exposure to air pollution and noise and injury. Health equity is a critical underpinning theme for us, and monetization, of course. Next slide, please. So there are 3 geographic scales that we as planners can intervene. The regional scale, transit, of course, with COVID, I'll be speaking about that a bit, is critical. Regional accessibility, making transit more competitive. Now dealing with a lot of changes in attitudes towards transit, which we think will go away post-pandemic as they have in the past. But right now it's a critical issue. But there will be long-term effects. And then walkability is the local access, neighborhood, complete street, complete neighborhoods have destinations, and that's the mixed use and the density piece. And then the pedestrian environment is critical. And then applying to TOD, transit-oriented development, green space, as I mentioned, active transportation planning, land use plans, comprehensive plans, OCPs, and health equity is said earlier. Next slide. So this is a graphic that kind of summarizes a lot of the body of work that many of us have been working on for quite a while. I now call this 2 pandemics for the price of 1, because there is a direct connection. The built and natural environment, the decisions that we're able to make that we test through these tools, where and what types of transportation infrastructure investments are being considered, and how that relates with the different land use decisions that are being made, where growth goes, what kind of development it is. The pedestrian environment is critical. Seating, lighting, street furniture. We now have Street View. We're operationalizing measures of this throughout the world. We can actually know where there are not only sidewalks, but where there's eyes on the street, and where there's good crossing characteristics and green space. These things affect travel and activity patterns in ways that then shape our behaviors and also impact our exposures. So diet, physical activity, energy balance or imbalance, social interaction, interacts in space and through time with these exposures, air pollution, traffic safety and crime and noise, to impact a biological response in us as humans, weight, inflammation, and stress. So there are many pathways to get to physical and mental chronic diseases, such as air pollution exposure increases inflammation that can cause diabetes. There's actually meta-analyses on that now, a huge amount of causal inference. So we know there's numerous pathways to get through to chronic disease, but now we're very clear with COVID that that's also infectious disease related. And we know the severity of illness and mortality are all related to whether or not you're healthy if you do get COVID or another infectious disease. So this is a new thing that, and it's not a new thing, but we're now thinking of it more in an integrated manner. Next slide, please. So, wow, we are seeing a huge change in the willingness, not even willingness, beyond that, a demand for reappropriating road space. People want complete communities. They want to be able to walk in their neighborhood. This is a normal street, which is a roadway in Vancouver with a lot of, San Diego, with a lot of right-of-way. And now there's plans to reappropriate some of that road space. Gas lamp district in downtown San Diego is also, lots of places all over, next slide please, are looking at major changes. NACTO recently put out a report that summarized a lot of these changes. So there's databases of places changing so quickly, it's unbelievable. Next slide please. So one thing that we've been doing as researchers is, of course, building a causal repository of evidence. This is a pre-post, so the Comox corridor in downtown Vancouver is a place where we've been doing lots of studies. We had a wonderful opportunity, the city of Vancouver funded us when I was at UBC to do this study. And these are the red are the cases, the yellow or kind of beige colored are our households that we recruited as controls before and after this greenway went in. Next slide, please. So you see before it was a pretty nice place, very leafy, green, and walkable. But after, next slide, road space was reallocated, making driving more difficult, shifting the relative utility in favor of biking and walking. That reallocation of road space is something that's now being considered in many parts of the world, where people have been home for over the last year, saying, you know what, there's nowhere to safely bike without cars, I can't walk, there's tons of space in the street, let's take a lane, let's do something different. And this is evidence of what would happen if you did that. Next slide, please. We got a lot of evidence. These are 3 papers that are all causal that have been published in Transportation Research Part D. Those within 300 meters of the Greenway reduced their transport-related GHG emissions by 1/5 or 21%. They were twice as likely to meet the recommended physical activity levels. And they were and then we also found those near the Greenway showed a 5-fold increase in the number of reported cycling trips just out this week in the International Journal of Transport Policy. We've got 4 more papers coming on this that we'll be doing lots more on COMOX, incredible good research, productive research project with a wonderful team. Victor No, who works with me on this, was a former student, has been very productive, and Andy Hong, postdoc who worked with me, who's now in Utah. Next slide, please. So Where Matters is a study that I've been leading at UBC in the Health and Community Design Lab for some time with my colleagues, Trevor Dummer and Alex Bagazi, and many students doing wonderful work on this. This is a continuum or a transect. Andreas Duani laid out that term a while ago, from the most car dependent to the most walkable. So we've quintiled the region into 5 levels of walkability, and you see examples of what that looks like. And then we measure very great detail the levels of walkability in each of these quintiles. Next slide, please. And what our first round of phase 1 of this study showed, that as you move from the car dependent on up to the most walkable, you see significant reductions, or we observe in our data sets. We have 2 really good data sets, the My Health, My Community data set of 30,000 people about, and then the BC Generations data set as well. 2 independent data sets showed dramatic reductions, significant in many chronic diseases. I'm just showing you diabetes as a place becomes more walkable. Next slide, please. And as park access goes up, we also witness numbers of parks, less diabetes. Next slide, please. So that's not causal. I was just talking about causal relationships earlier. So monetization is a key theme for us. Characterizing the built environment, which the scenario planning tool allows us to do. We then model physical activity, public health impacts. We can apply a cost of illness, monetize those impacts direct and indirectly through input-output models, and capture a lot of other health-related impacts. Next slide, please. We've done that in a number of places, and I'll just draw your attention really in the interest of time to the one on the left. For the LA region, we were hired a few years ago, worked with AECOM, and we were able to run the model that is used to justify roadway investment, showing workforce productivity benefits of often, easing congestion, getting people to work faster. But we took that tool and actually showed the productivity of people who are healthier to go to work, yielding an $8.41 payback for every dollar spent on active transportation. LA has a $13 billion set aside for active transportation infrastructure. This evidence, working with AECOM, helped us justify that that money's well spent for active transportation and is providing good service and is actually economic, on its own economic merit, competitive with roadway investment, let alone the health benefits that come as a result. Next slide, please. So the digital divide, social justice and equity is critical in all of this work. And I'm getting close to wrapping up. I want to turn it over to Eric and Christine. And basically, adverse economic impacts of COVID-19 are largely borne by those without reliable internet access. We know this. This was work done in San Diego through SANDAG, the regional planning agency here, that's doing excellent work on a variety of these topics, and really bringing to the forefront this critical issue of equity and social justice. Don't have enough time, but I'm sure you're all aware of the term, or many of you, digital divide. Lots of research showing the inequitable distribution of access, not only to transportation and opportunities geographically, but even to the internet, which is now dividing our society even further. Next slide, please. So COVID is not just a good story when it comes in any context, actually, except for the fact that it seems to have yielded a more willingness for walkability in local neighborhoods. Sprawl, people working at home are able to live further from where they work and can live further out. This is being observed, tons of media, we're all aware of it. Next slide, please. Real estate prices this is what this slide basically says, but the bottom line, and you can review this later if you want, but I went and combed some evidence off the internet stories, but basically in-town prices not going up much in New York and San Francisco, the last bullet, prices actually fell. I was surprised to see that. But in the outlying areas, the prices are just skyrocketing for a long time. We actually did not witness increases in price at the edge. In fact, they were declining. So we are seeing a major shift in the real estate market that is very worrisome. Next slide, please, from a health perspective. So about scenario planning, well, basically this slide makes it clear the physical environment is accountable for approximately 10% or thought to be of health outcomes, impacts on health, obviously social and economic factors, 40%, clinical care 20, and health behaviors 30. But the physical environment has an indirect effect on health behaviors, of course, as well. Next slide, please. And it's modifiable, most importantly. So scenario planning, Eric will talk about some details. This is to compare the impacts. Typical impacts include things that you can measure, population, housing and jobs, financial costs, transportation access, resource management. More recently, health impacts, as we're talking about, are being integrated into long-range regional transportation planning, master planning, infrastructure investments, and development proposals. It is geographically scalable, can be done at the regional, corridor, or neighborhood level. Next slide, please. So I think we can just jump ahead to the next slide, in interest of time. First, you identify, it's very data intensive to do this work, clearly. But we have built a lot of the data layers that are needed for it for the whole United States. And also the data exists in Canada. And we have examples, of course, where we've run this. These tools have been around and they are starting to get used more. And it's quite an efficient way to make an empirical estimate of a health impact. You identify the data needs, you go through a data development process, analyses and tool development work is done. So you create the research engine. That's what we've been doing using the statistical modeling. And then basically the tool is a shell that holds regression models and statistical models that then get applied in the real world. And then calculates new values for the predictors and solves for something like diabetes across a range of outcomes. Next slide, please. So I think this I'll leave this to you, Eric, and to carry forward and show how the tool can be applied.
Okay, thank you very much, Larry, for introducing scenario planning and the wide breadth of work that we've worked on. So I'll start off with looking at a Canadian case study that we looked at in the West Don Lands in Toronto. And then, as we mentioned, we'll look at a case study in Stockton, and Christine will come back in and introduce that. And I'll talk a little bit more about some of the results that we found from that study. The Healthy Canada by Design initiative, you might be familiar with, is a pan-Canadian program aiming to link planning with health agencies. And so for this project, we are supported by Toronto Public Health, and we wanted to identify an area where we could apply a health-based decision support tool to both assist planners and policymakers in decision-making. So just mention that this project was supported by the coalitions linking action and science for prevention, or CLASS, as well as the Heart and Stroke Foundation. So if you're not familiar with the Toronto area, the West Don Lands is a former industrial site adjacent near the Toronto waterfront. And it's part of the revitalization of Toronto's waterfront. And along the entire waterfront. This is just one area to the east of the downtown core. It was the site of the Athletes Village for the 2015 Pan American Games. And so this image on the left just shows you an idea about what it was like in the past. And the image on the right is showing you the West Don Lands, an artist rendition for what the future of it could look like. And so what we did was we built off pre-existing plans for the West Don Lands that were underway in the mid-2000s. And we gathered information from three main plans: the precinct plan, the block plan, and the Pan American Village plan, which outlined the building development, design, typology along those lines for us to use in this project. And so this we thought was a viable site for application due to the significant built environment changes that have and are going to continue to occur in this area. This is an 80-acre site, and it's because of its proximity to downtown Toronto. It's really slated for dense mixed-use development. So the plans call for upwards of 6,500 housing units and 1 million square feet of office and retail. And the Toronto Transit Commission also added a new streetcar line to this area, as well as changed their bus service for the area. So the plan calls for one additional new school, as well as 2 parks, both of which have been created, and adding around 20 acres of parkland. So for this scenario build out, we're looking at the 2030 or so horizon. And the image on the right is showing you the West Don Lands in gray and its proximity to downtown Toronto, just to the west. And the pink is showing a sort of impacted area of a 1 kilometer walking distance that we also looked at for this project. So I just wanted to show you a little bit of the current conditions, as well as what the West Don Lands looked in the past. So the image on the left is showing a previously early 2000s photo, aerial photo of the area, and the images on the right are showing sort of the current day feel of the West Don Lands. So we can see there's the major Corktown Common Park has been added, as well as portions of high-density residential and mixed-use corridors. We'll just highlight that specific areas, this Mill Street community here, as well as the Front Street community here has not yet been undertaken, but that's within the plans for building forward. So some of the data sources that we used on the built environment side, we looked at the postal code geography and developed built environment measures, specifically the walkability index and other components of that measure. We also looked at food, retail and destination access, green space, and transit expected improvements. And these are some of the data sources and so, as Larry explained, just along the process of the development, we sort of started with preparing the data and moved down towards looking at reporting existing and future conditions, and then being able to use this tool in the future to iterate. And so for this project, we made use of the Community Viz tool, which is one of the 3 major, most popular scenario planning tools. And some of the demographic covariates that we used for this project are your typical ones, but these included age, sex, household income, vehicle ownership, education level, and employment status. On the health and physical activity data side, we relied on the Canadian Community Health Survey, which gave us some cardiovascular information, as well as walk trip occurrence and daily energy expenditure. And then we also use the Transportation Tomorrow survey, which is a survey that's operates in Southern Ontario municipalities. And specifically, we looked at, obviously, the city of Toronto, and these gave us some physical activity trips, as well as auto and trip length that we are interested in looking at. And so from this, we were able to develop these multivariate regression models that we use to create small area estimates for health. So the future scenario, these are some of the results. This table shows we're looking at adding about 1,300 new people within the study area and 2,600 or so, 26,000 rather, people within the impacted area. And so we can see by the bolded and green variables here that this both in the study area and for the impacted scenario that we were able to see increases, especially within the study area. So in the positive direction, and the underlined variables are also showing reductions, also in a positive health direction. And so these included increased walking and biking trips, as well as reduced automobile trips and reduced trip distance. And so I think with that, I'm going to transition over to Christine, and she's going to be able to tell us about our second case study that we're going to look at, the South Stockton Promise Zone. So Christine, please take it away.
Hi, good morning, everyone. So quick introduction of the San Joaquin Council of Governments. We're located in the Central Valley of California, and we're a designated metropolitan planning organization. So with that designation, the agency is responsible for regional transportation plans and programming of local, state, and federal funds in our region. So our region consists of San Joaquin County and all of the cities and the unincorporated county areas. And so as part of our regional transportation plan development activities, we're also required to address environmental justice in our RTP so that, you know, we're analyzing what type of impact our plans are having in our EJ communities or our communities of concern. And so part of that work for us to address EJ in our RTP is we, in our last 2018 RTP update, we piloted our first health indicators with the help of UD4H. And on the next slide, we have, Eric, do you have this slide?
Sorry, yeah.
There you go. So this is kind of a just a brief excerpt of what some of those performance metrics we included during our 2018 regional transportation process. There's different phases of the project as we develop the plan. And one of the key parts of the plan is to present some scenarios to not just our public, but also to our stakeholders and eventually to our board members. And so we were able to work with UD4H to calculate the health impacts of each of the scenarios in our regional transportation plan so that everyone could weigh in on, you know, kind of a full picture of what impact the plan would have. So health, these are a couple of the health indicators we included in 2018, but we also looked at, you know, weekly walking minutes per person, daily total biking minutes. And that was part of, you know, kind of a long list of other metrics. Traditionally, you know, we look at, you know, the length of a trip. What is the mode split? You know, how many people are taking cars versus buses versus bikes or walking to their destinations, and all other kinds of metrics. But 2018 was the first time we actually included this as part of our evaluation and our decision-making process. So to build on this work, on the next slide, I'll kind of set the scene for this project that Eric's going to be presenting about. Since 2017, SJCOG has been convening a group of stakeholders in our South Stockton Promise Zone to identify collective action strategies to transform the neighborhood under 3 priorities, which are housing, economic, and quality of life factors. The reason why we became involved in the South Stockton Promise Zone, because it really gets to the heart of what SJCOG is trying to do in terms of really addressing environmental justice issues and being you know, engaged at the local level in communities that are most impacted by these environmental justice issues. So on the next slide, Eric, so for the region, this is the promise zone is where most of our disadvantaged communities reside compared to the entire city population. This is where there's higher concentration of poverty, where residents are more burdened by housing costs, meaning that they spend more than 30% of their income for rent or mortgage. And then this is also where there's a higher concentration of communities of color in our city, and residents are more likely to be foreign born and or have limited English speaking proficiency in their households. And so all of these factors contribute to and may indicate mobility challenges that are unique to these community members, such as difficulty navigating the transit system. If you're not able to read a bus schedule in English, that might inhibit your ability to travel from one part of the city to the next. Also, experiencing poverty is also presents a challenge for being able to afford private vehicle. And in our city, it's a suburban kind of landscape, and a private vehicle is really, or access to a private vehicle is one of those resources that not everyone has the ability to afford. So SJCOG has worked with these stakeholders to better understand some of these challenges and then to develop strategies to bring about some neighborhood improvement. And so with that work and building on the 2018 work with UD4H, SJCOG and UD4H developed a follow-on study to understand what impact if the city and the COG and all the different stakeholders kind of came together and really put together some ambitious planning and investment in the promise zone, what health impacts or other impact could that have on health? And so that kind of just lays the stage out for Eric to speak more. I think the next slide gives us a little bit more data. Yeah, so here you'll see data from the Census Bureau, really further reiterating how different and how the needs are specific in the promise zone. So across the county, you'll see 34.4% populations of color and 22.5% concentrated poverty. But as you kind of narrow in on the promise zone, those numbers become starkly higher. And so that just really speaks to the unique needs and the importance of collaborating to really address this issue.
Absolutely. And so just before we leave that, just so people know that this red boundary on the map here that I'm highlighting covers the South Stockton Promise Zone. So it does include areas, most areas in downtown Stockton, as well as large portions of the south end of the city. Thank you, Christine. That was a great overview of the South Stockton Promise Zone. So I'd like to just, keeping with this theme, introduce the National Public Health Assessment Model, or N-PHAM. So this was the main health outcome tool that we used to apply in metropolitan Stockton. And we developed this in collaboration with the US EPA, specifically the offices of sustainable growth, sustainable communities rather. And so this is, the idea of this is that it's a national tool that has coverage across the United States. And it's able to quantify localized health impacts of alternative investment scenarios. And it's really designed specifically to support projects such as RTPs in Stockton and long range transportation planning. And so this tool uses federally available, federal agency available data at the national level, but it also allows for local data integration, which is what we used, which is what we did for as part of this work for this health equity study. So it uses statistical regression models, specifically looking at the built natural and social environmental effects on health. As we mentioned, because this is a national tool, the level of analysis is a census block group, which still provides fairly fine resolution. spatial resolution for analyses. And it leverages two unique data sets: the California Health Interview Survey, which is developed by the University of California, Los Angeles Center for Health Policy, that looks at a wide range of health outcomes for all counties in California. And we also used the National Household Travel Survey, specifically the California add-on, which was a major California-specific survey add-on to the NHTS, looking at travel behavior and also providing physical activity variables for us. N-PHAM can be delivered in a variety of different ways through an application programming interface. And so this integrates with three of the main scenario planning tools: Urban Footprint, Community Viz, and Envision Tomorrow. And for this project with Stockton, Stockton's a user of Envision Tomorrow, and so we continued that and used that tool. It also has a web application built through our Shiny, as you can see, that helps identify the scenarios and toggle through different variables that you want to look at. And there's also more of a script-based, allows for more custom input option for how this tool can be delivered. So some of the data sources on the built environment side that we used, we started with land use at the parcel level. And we specifically looked at building built environment measures such as residential density, employment mix, as well as some destination access. We brought in green space and transit. And these are some of the data sources that were provided locally, including the Regional Transit District of San Joaquin. So building off of that built environment data, we used the pre-existing scenarios that SJCOG had developed as part of their RTP process, the three scenarios that Christine identified: scenario 1, 2A, and 3. We basically looked at a series of specific development place types. So this image on the right tries to show you what the difference between a development place type versus an individual building. Just the development place types are a package of that can be painted or drawn into a scenario in GIS. And so these include urban centers. They have specific themes: office, park, suburban, residential. And within there, you develop this blend or mixture of individual buildings. So high density, above 12 stories, 3-story residential, mixed use, and different types of employment. And so this really forms the basis of how we develop the land use component of the future scenario. And so, as I mentioned, we targeted 9 of, there's more than that, of the custom development place types that SJCOG uses, and specifically looked at along the lines of the building mixture. You can see here the spread between commercial and residential. And the development rate is also important, as that indicates that just because you are saying that an area is going to develop in using this development place type, that doesn't mean that in the future all of the parcels, all of the floor area are going to be all transitioning to that. Rather, you use a redevelopment rate that sort of determines what the infill development rate is. So in this case, we're looking at the likelihood of a faster redevelopment rate in the downtown for place types related to downtown Stockton, and then lower ones for other ones such as suburban residential and other areas. So using that information, we broke out, looked at a variety of demographics and employment, which are key drivers within the models that determine health. And we look specifically at how are the housing units going to change, and how is employment and jobs going to change based on these scenarios. And so this table shows you on the left side the current conditions and our baseline for 2015, and then the adopted scenario for 2035, which is the 2A that Christine introduced previously. And so we can see there's some shift here. And then we took this even further and did a more aggressive, a little bit more bolder scenario for the same time horizon, but increasing the shift further away from single family, more to townhouses, townhouse units and multifamily. And so that's what this table is showing. And on the employment side, we wanted to heavily focus on neighborhood, retail and mixed use corridors. And so we really focused on adding retail and office jobs. And you can see how those are increasing into 2035. But we sort of start off with this 75,000 people scenario within the South Stockton area, and then we go further from there. So just before we get into the results, looking at some of the outcomes, we then needed to aggregate and go from that super high resolution parcel level scenario. This is a map showing downtown Stockton with some of the place types filled in. And then we aggregate these to block groups so that it links with the health outcomes, the small area estimates from CHIS and from the NHTS that we have. So you can see concentrations of populations in the downtown, as well as some of the block groups that aren't expected to change very much. So just looking at some of the results for the forecasted changes, looking at utilitarian walking. The map on the left is looking at walking for transportation, specifically daily minutes duration. And the map on the right is looking at that same variable, but looking at the change between 2015 and 2035. And so we can see largest concentrations in the downtown core, where we're expecting the most intensive development, as well as some areas also in the airport corridor, which is a key corridor in Stockton and for SJCOG. So now just the last couple of slides, I'm just wrapping up here, but we'll look at the outcomes that we found. So first, looking at physical activity changes. The left side shows you which physical activity measures both duration minutes as well as participation. So we looked at utilitarian physical activity by walking and biking, as well as leisure physical walking. And so same components, we can see the baseline, the adopted scenario is increasing these, walking for transport by 20 in the South Stockton Promise Zone, and biking by 33%. And then we take that even further in the more bolder scenario up to 35 and 45% increases. And so these definitely show the utilitarian physical activity are definitely showing the highest increases due to this new development scenario, and for 2035. And so looking at some of the chronic and cardiovascular disease outcomes, these are some of the variables that we looked at. And so we can see both the adopted scenario and our more bolder scenario are decreasing type 2 diabetes and high blood pressure by 6% and 4% and 9% and 7% respectively for the more bold scenario. And all of these measures here are decreasing, which is in the positive direction for health. So we can see a similar trend, although a little bit more modest for the mental and general health status indicators, where we looked at fair and poor general health, as well as some measures of mental health and depression, psychological distress. So I think that pretty much wraps up what I had for looking at the South Stockton Promise Zone. As I've gone along here, we've had sort of sources at the bottom, but we did, as Larry introduced, some of the publications that he's done on the Comox Greenway. Also just wanted to highlight that we published 2 articles on the West Don Lands project and the Healthy Canada by Design initiative in the Canadian Journal of Public Health, and on the South Stockton Promise Zone and the SJCOG work overall. We have a publication in the Journal of Transportation and Health, as well as Social Science and Medicine. So I think with that, those were the main highlights. Thank you very much. And we can get into any questions. I'm sure you have many, and look at some discussion questions as well. So Tina, do you want to lead us along here? or anyone can open for questions.
Great, thanks so much, Eric, Larry, and Christine. So we'll move on to questions now, and subsequently discussion questions. So we do, because this is going to be an interactive discussion, we do encourage you to speak up if you'd like to by unmuting yourself, and just chiming in or typing your comments or questions into the chat box. And Eric, do you want me to pull up the poll questions?
Oh, yes. We didn't do those. Yes, please. Let's do a couple of the poll questions. We forgot to do that. Yes.
Okay, let's start with the first one.
So sorry, we meant to do this at the beginning, but this is just a couple poll questions just to see about our audience for today. So this question just asks, what type of organization do you work for? And just if you can fill in quickly, just so we have an idea about where everyone's coming from. So it seems like a strong representation from levels of government. And we're just about 71% voted here. So yeah, relatively even between the federal, provincial, a little bit higher for regional or local government, and 15% at educational institution, and some private sector and other as well.
Okay,
so I think we'll just,
that one?
Yeah, we'll go ahead and end that one and go on to the next one. Yeah, and so this next question just looks at in what ways have you used scenario planning or similar tools? I've given you a broad overview now, but just wanted to know how much you're familiarity with them. And so maybe you've used them for land use planning, transportation planning, resource management, or health impact as well. So we're seeing about 50% or so haven't used them before, but I'm sure they're interested in them. And of those that have used them, it seems like a mix between health impact, transportation planning, and land use as the focus. So we'll just give this just a second longer here before we go on to the next one. Yeah, so you want to advance to the next one, Tina? Okay, and then what knowledge are you most interested in gaining from this webinar? Again, these were meant to be at the beginning, but we can take them now just to get an idea of our audience that's out there. So yeah, definitely strong focus on health outcomes and built environment, and perhaps some of the geospatial or scenario planning components. So yeah, I think we can go ahead and end that. I think that's the last one.
Just one more.
Okay, we have one last one just on where people are coming from today. Where do you do the majority of your work? So we have a fair amount of people from Canada. That's great. And a fair amount from the US, and 7% right now from the rest of the world. So that's good. Good North American coverage, which we expected, and a fair amount of people from the States. So thanks for joining us. So yeah, I think we can end that polling then and get into any questions that people may have.
Great. Okay, so I see one question in the chat box. Eric, if you want to just press on the chat box window, you can read it all. So the first one, excellent work. Do you have inputs about the health impacts of the form-based code interest? Knowing land use planning also helps in target high-risk activities for populations.
Yeah, so Larry, do you have some ideas on that, on form-based code? So I'm thinking that's specifically related to zoning.
Yeah, it's a more visual. It's a progressive form of regulating land use. But I don't know. I mean, I don't have enough information from the question to know. We can test scenarios that use zone designations, whether it be traditional zoning. However, the land use designation is derived through form-based code or otherwise. The tools can definitely test different measures of mixed use and density that are controlled by zoning, subdivision regulations, control connectivity of the road network, and building codes, of course, are more site level. So I'm not sure exactly what the person who asked the question, what Maud was after on that, but definitely the fact that form-based codes are more visual and a little bit more flexible, I think holds a lot of promise for scenario planning, because it's a bit, the scenario planning is a visual tool. So I think it's a good question.
Yeah, and so I just say that certainly a fair amount of, that we introduced the West Donlands and plans related to that, sort of outline what the built environment can be, and definitely I think that there's a good range of what the specific zoning can apply. What we've really focused on is getting as objectively measured built environment as we can, and so really not knowing necessarily what the specific zoning allows, but rather really being interested in what is actually the current conditions on the ground, whether or not the zoning applies to that, and then what is the future scenario also along those lines, parcel level.
So Eric, Maud added, she's wondering about the risk of not being able to locate high-risk activities. That's not necessarily true. We definitely can locate. This tool is fairly geographically precise. Most of the tools that we built, the first tool, the West Donlands, the one that we showed in Toronto that was built, as well as most of our tools, the California Public Health Assessment Model, all of it's parcel-based. So we're down to very small geographies, and we can locate whether it be a high-risk activity or something that has a positive effect like a park. It's fairly geographically precise.
Okay, thank you for that. Hope that answered your question, Maud. So next question. Great work. Can you tell us more how you calibrated the effects on obesity, etc.?
Yeah, so I can just talk about the N-PHAM first on the calibration. So we, for these health outcomes, we used the California Health Interview Survey, and we did do some calibration using BRFS, Behavioral Risk Factor Surveillance Survey, which is available, developed through the CDC and local public health partners. The numbers here, but we did sort of calibrate to those and found that on the whole, the CHIS and the BRFS calibrated were quite similar, with a couple exceptions. I think maybe type 2 diabetes, and that overall our models, I think, depends on the scenario and the different measure and where you're looking at. But overall, we were quite closely aligned or a little bit under what BRFS was reporting.
So just to add, that was great, Eric. The scenario tool predicts a chronic outcome and at baseline, and then we can compare that to another independent data source through validation, and that's what Eric's talking about. So we predict and then compare to what's observed, and we came in really close. We did that we had to do that in Madison, Wisconsin, actually, with the California data. It's a big question: is the data that's largely based in California generalizable to the rest of the United States? Or, for example, if we build a tool in Vancouver, is that going to be generalizable to the rest of Canada? And when you adjust and control for demographics and built environment characteristics, at least our observation so far, if you have a large enough sample size and the modeling is done correctly, the external validation has worked out to be pretty accurate.
Yeah, just along those lines with the CHIS, because it is such a large sample and samples from throughout California, you really have quite a range in distribution in terms of environment as well as demographics, from the most densest places in San Francisco, downtown San Francisco, to a lot of other rural areas in California. So with that, we're able to have a breadth of environment that we can use to project out and forecast these small area estimates for other locations in the States.
Okay, thank you. So next question, I think it's for Christine. Question about the word promise from a project name South Stockton Promise Zone. Seems to be not based on built environment concepts, but more on the anticipated result. Is that correct?
Yeah, sorry I didn't provide this background, but during the Obama administration, there was a HUD program, a federal program called the Promise Zone Initiative. And so promise zones were designated as high poverty communities where, you know, the federal government, as long as local partners could work together, collaborate in terms of, you know, addressing multiple kind of areas where a community might be in distress. So example, economic activity or education, public health, and other types of issues like violent crime and lack of private investment. And so the Promise Zone originated, like the concept and the initiative in South Stockton was initiated in an effort to get this federal designation back in 2015. The funny thing is that South Stockton never actually got the federal designation. It was like a runner-up, but the HUD department, they were so impressed with, you know, the level of collaboration and collective action that stakeholders were taking at the local level that they still considered South Stockton as like an honorary promise zone, and they also assigned, you know, some of their federal agents to participate in the promise zone. And so to this day, even though the promise zone program doesn't exist anymore, our partners still engage with HUD representatives on a regular basis, so that we're communicating on potential programs and grant funds that could be applied to address some of the issues that the community cares about.
Okay, thank you. Next question. Would you say the tools you presented can be used both as decision-making for scenarios and as monitoring?
Eric, why don't I start and then you follow up?
I'm not sure I heard all of it. Could you repeat that question? Sorry.
Sure. It's a question from Maud. Would you say the tools you present can be used both as decision-making for scenarios and for monitoring?
Yeah, it's in the chat box. So the tools are more, yes, they can, but the actual regular periodic update of the data that are used to go into the tool, the predictors. So there's multiple time points now of built environment metrics. We just completed the construction of the second wave of the Smart Location Database for the US EPA, and the Robert Wood Johnson Foundation also support this work through the what's called the National Environment Measures Database that Eric created, and along with other members of our team. So the periodic data points of those data sets, the actual changes in the physical environment tracked over time is really even, you know, is available as well to track how places are changing and provide direct input. But the tool can then predict from that into the future what would happen if you changed the place in a certain way. I hope that answered your question, at least partly. Maybe Eric can finish.
Yeah, no, and there's definitely, you know, as part of we developed SJCOG developed 3 potential scenarios, 1, 2, and 3 that Christine outlined that we didn't go into, but there's definitely a lot of iterations possible. And when they do the RTP process, they look at the 2035 scenario, so a 20-year build out, but they also do a shorter one. And so I think it can be used for monitoring just to see over time how that's changed. And when you have, as Larry explained about the time series, both on the new built environment coming in, and with that wealth of it, you can adjust the inputs and see how it changes, and then potentially decide, cast your scenario format further out to 2040 or 50 to see how that changes. So I think they can definitely be used. They're first and primary primary point is to forecast the future, but they can be used for monitoring change. And as that new data comes in, you can actually be able to compare what did you forecast versus what's on the ground. That answers your question.
Okay, great, thanks. Next question.
We do have
how do you think
with,
about, oh.
Sorry, I was just gonna say, we do
ahead.
have some people with raised hands, so I'm not sure if we wanna switch back and forth.
I've asked them to put their, I've asked them to put their questions into the chat box for now.
Okay, great.
Just so we can go in order. Okay, so next question. How do you think the places for emergency gatherings, such as an earthquake, and for other healthy activities like group dancing?
What do you think about this? So this question, I have to think of, and by the way, Tina, I think the one just before, well, maybe we should get to after this one. I think we may have skipped by the required training and knowledge question. How do you? I'm not sure how to answer this question. I guess that one thing that we do have is objective data on physical activity in many of our studies. I noted, I think one of my closest colleagues I've worked with for a long time, Jim Salas, is listening in, is a leader in physical activity measurement. So we use accelerometry in a lot of our studies. And that allows us to measure what people are actually doing in given locations when you integrate that with GPS data. The issue is that level of data robustness is difficult to get in a sample large enough to extend to have a predictable, reliable estimate of chronic disease. So the tools there's a bit of a conflict in a way where we need large surveillance data sets with spatial information and good built environment, built natural. We have good measures on green space and the demographics as well. That allows us to have a reliable estimate on chronic outcomes. When you want to know more about the kind of details you're asking about, we would rely on more sample and surveys that we have on smaller sample size. It's a different kind of a way the tool could be calibrated. And we haven't done that quite yet, but it's a good question.
Okay, thank you. Sorry, I missed the previous question. Can you comment on the required training knowledge that's required for some of the modeling programs? Are they menu-based or more coding-based?
So I can start with this, and Larry can add on. Certainly, the original idea of the scenario planning tool is to use GIS, but to be able to, if you wanted to really use it for engaging with the community and really showing a variety of different scenarios. And what if we put some transit stops here? What if we change this land use? And so the actual interfaces, the three that I reviewed, Urban Footprint, which is developed by Calthorpe Analytics, Envision Tomorrow, which is developed by Friganese Associates, and Community Viz, which is developed by City Explained. All three are user interface based, so you need to have some GIS background, but it is it can be a point and click component. But as far as the health modeling components that we build in here, these are pretty complex regression models. And so to be adjusting those or adding new health outcomes that you're interested in probably takes some good statistical background. But the actual scenario planning can be as simple as choosing a development place type like I showed you and painting it on the scenario and recalculating the outcomes. Larry, do you have anything to add to that?
Yes, oops, so
you're still on.
Yeah, thank you. Great answer. Just to add is that once the tool is built for a certain geography, it's easy to apply, much easier. All the work is done in terms of calibrating it, and then you have to know what your scenarios are, what you want to test, but it's pretty easy to use by then because it's all the measures are already there, so you can do what ifs with your community leaders, stakeholders, and you can test and dial up and down different characteristics of the physical environment, a given location, and the tool will give you a predicted outcome. So that we did first for San Diego as a region. We then moved it, well, actually the first one we did was in Seattle, then we did one for San Diego, one for the state of California, and now for the whole United States. The one in Canada was calibrated and is still current enough to be used for Toronto, and it was then applied to, as part of the CLASS project, Canadian Partnership Against Cancer, to Surrey. It was applied in the Vancouver region with pretty good results. All that has been done fairly easily once the tool is built.
Yeah, and it's definitely designed to have multiple case study examples. So this tool is designed to be used anywhere in the city of Toronto, the one that I looked at, and within San Joaquin County, the entire district. If you want to look at a specific other case study area, like a new corridor that you're developing or a new building plan, it's designed so that you'll be able to go right in, still get health outcomes, even though that wasn't the original case study area.
Because the predictors already exist for the whole geography. That's why. We have all the physical design measures already calculated, like a canvas.
Okay, great, thanks. Next question, what makes a local government uptake this kind of project? So I'm guessing from the presentation, there are some have involved. If not, what would make them implement these projects?
Christine.
So one of the reasons that SJCOG took on this work was because of the explicit requirement for the agency to address environmental justice in our planning. And so for us, we've got guidelines and requirements from both the state and the federal level kind of guiding us to address health in a more meaningful way. And this was our path to doing that with our RTP process. I recognize not every locality or regional government might have the capacity or the budget to do something like this, but there may be, I know that there are like some statewide tools that were in development to provide, something of like a tool for other agencies who don't have the capacity to do similar work with their plans. But I'm not sure where that is at this point. UD4H may have been involved in that effort back in 2016 or 17, I think.
We could maybe add a bit to that. So for example, the Los Angeles Metropolitan Planning Organization, SCAG, or the Southern California Association of Governments, clearly wanted to be able to document the health benefits of active transportation infrastructure investment as part of its transportation funding package that it had obtained. A large amount of funding has been provided through bonds, as many of you know, in LA, like greater than $150 billion. So they want to be able to protect that money for active transportation, need to be able to document its benefits, that investment makes sense, even from not just the health, but an economic perspective. So that study that I mentioned was done for that reason. Many MPOs or metropolitan planning organizations in the United States are now operating under, there's increased awareness. The public with COVID are becoming increasingly even vigilant about making sure that health becomes part of the discussion, are aware of how their neighborhood and their community affects their health. With equity, as we learn the distribution, the data that's going to come forward now on the spatial distribution of who got COVID and who didn't and where they live, we're in a definite deflection point of change, and all the mounting accumulating evidence on how health is impacted by physical decisions about communities. Seems like this is why we're seeing more and more agencies use the tools that we have. We have a few clients that are, they're all different. Every single one seems to have a different reason, or whether it be a legislative mandate or individual characteristics of the people that work in the organization.
If I could just add one more thing to Larry's point. if health isn't, the motivator for a city to be involved or to look at health impacts, funding would be the other motivator, because a lot of our state programming and grant programs these days are incorporating health impacts and understanding what those benefits are in the application process themselves. So if it's not health for health's sake, it's going to be for funding as well.
Thank you.
Thank you. There's quite a few great questions still in the chat box, but I wanted to get to the discussion questions that Eric came up with. So Eric, do you want to pull up the?
Sure, yeah, and I think we're flexible with these discussion questions, as well as we can field the other ones. I see some more interesting ones in there.
Okay, so why don't we leave the questions up on the screen, and I'll move on to the next question then. And sure. If folks have any comments or anything to add, or anything to contribute related to these discussion questions, put them into the chat box. Okay. So next question, in light of Larry's overview of the potential for not monetizing the value of health impacts from transportation and land use choices, how would that monetization concept relate to the Toronto and Stockton case studies? I can see benefits from improved BMI, reduced VMT, etc., but are those data points to calculate in present, such as for performance-based planning?
Yeah, so I think Larry can definitely comment on that latter part of working towards more performance-based planning. But I'll just outline, so we monetization component for the Toronto and the Stockton area, but the project that Larry outlined, both we did a project for the Utah Transit Authority, statewide benefits, Utah statewide benefits, as well as in the SCAG region. Can definitely look at both within the monetization piece, both direct. In that case, in Los Angeles, we were looking at the active transportation infrastructure investments and how both the direct benefits from that, so in the form of jobs and actually creating this new infrastructure, as well as the indirect benefits, so the healthcare potential savings, such as reduced type 2 diabetes or other chronic diseases, and as well as reduced absenteeism and a reduction in loss of workforce productivity. So Larry, do you want to talk about the sort of how this can address performance-based planning with regards to health?
Yeah, thanks, Eric. Well, Chris, really good question. This is an evolving, obviously the science is evolving, the research, and now the science and the practice-based component is catching up. And the policy frameworks aren't really there yet. We have fractured, or intentionally, and the evolution of a very separated funding mechanisms. The health benefits that accrue, that get monetized, aren't enjoyed by the municipalities that might be funding them, making the decisions to make investments, on the transportation sector. So there's work to be done, a lot of work to be done to integrate these disciplines around these issues, as we know. So there's this institutional piece that is really, I think, at the core of your question, but we are, as a society, moving in this direction very clearly. We're identifying a gap that's pretty big by having that fracture between health and transportation and planning decisions on the financial side. So there is the ability to develop tools. The Where Matters project in Vancouver is really moving in this direction to move towards a more performance-based funding approach to transportation investment, where the changes in communities expressed over time and measured through our data and the data of others, tracking how places are changing, the achievement of more increased walkability, things that improve health and reduce healthcare costs, and increase the productivity of our society and our workforce, and also reduce greenhouse gas emissions and address equity and social justice can be rewarded with funding by tracking those measures. That's a performance-based or results-based approach to funding that can take place now because data is now available to make that possible, given the political will to move in that direction. Thank you.
Okay, thank you. So next two questions are related to the application or use of this methodology in small or very small cities or in rural communities.
Yeah, so as I mentioned, the N-PHAM tool, which is the national US tool, is really designed to be applied, to be able to be applied in rural areas and in areas that that have reduced resources. They don't have a large planning staff, maybe don't have GIS expertise. And so with regards to the rural areas, and I'll let Larry comment on that a little bit more. So we looked at Toronto, which is obviously a very large urban area. Stockton, sort of a mid-size city, about 700, 800,000 in the metro area. And so I would just say, with regards to the models that in a rural area, that you could definitely see a direction change towards a more positive health component. But it might be a little bit more difficult to see some larger magnitude health outcome changes just because of the smaller population and probably still doing a lot of low density development. Larry, do you have anything else to add to that?
Yes, so Gary lives in Anacortes, Washington, who's asking this question and probably wondering, is this something that could be applied? He's on council there. Is this something that you could use to test different scenarios of retrofitting the main street or the land use planning that's going on kind of for the city itself? Yes, it could be. The principles hold. The tool would need to be for an independent city that's not part or at the edge of a major metropolitan region. If it's part of a large metropolitan region, then yes, it makes sense, even if it's an outlying community. But an independent standalone community, which I think Anacortes, for example, might be, the relationships between the built environment measures and the natural environment, green space, and the health outcomes or behaviors and health outcomes still hold, but differently. And so it's possible to apply the tool, but it would have to be recalibrated significantly. Rural communities, I don't think the tool can be directly applied. I think we need to look at building a separate tool that is focused on rural areas that are really quite different.
Okay, thank you. And next question also from Gary. Have you developed comp plan language to help communities include the policy directions in their plan process?
Okay. We are working on that, and we have a couple projects right now where that is happening. More of the work has been at the regional level, MPOs, metropolitan planning organizations, and maybe to some extent state. We have been working with some local governments, and actually more not through UD4H, but through UBC, through the research project, the Where Matters project. Yes, that type of work is happening now, but not as much at the municipal level directly integrating into the comp plan. We hope to do more of that in the future, and I'm sure other researchers and people working on this topic are thinking the same. I don't know, Eric, if you want to add, maybe the King County work that we did, kind of, I don't know.
Yeah, I think, in the past, we have definitely helped with some comprehensive plan support. But yeah, as Larry mentioned, largely at the metropolitan region.
However, I really think to answer this question completely, you need to add something. Land use is controlled through local government regulation, and most of the end users of this tool are going to be municipalities. And we have worked a lot. All of our projects have included municipal partners, and we work with cities and counties regularly, and recognize that that's the main end user that we anticipate. this is the launch and the beginning of a new science, actually. And we are seeing many cities express a lot of interest. Honolulu was one that we've spoken a lot with about applying the tool. But there are many, many cities that we are in contact with and have worked with as well. Obviously, the city of Toronto is one. But city of Toronto is almost like a region itself, its government.
Okay, thank you. Next question, are you using machine learning to assess urban environments in any current studies? Maybe in terms of quality of streetscape?
We have partners that we are working with extensively on this topic. And yes, of course, many of the modifiable features of the environment are at the pedestrian scale. And so definitely on that and working very extensively on that topic. We also have other simulation techniques or data mining tools that we've been using because the data sets are so huge. They lend themselves to it. So we've, before big data was a term, this type of research required it. So yeah, there's a, very happy to discuss further if you'd like to talk offline. We'd be happy to chat further.
Yeah, and that, thanks for the question. Alberto is a colleague of ours on the IPEN project. And so I think he's on the call here from Brazil. So thank you for joining us. And just all along the streetscape component, we worked with the team in Brazil there on an international study that we actually have a paper coming out shortly, specifically looking at the microscale environment. So Larry introduced that at the beginning of the presentation. But yeah, certainly with the widespread advent and coverage of applications like Google Street View, there's definitely a lot of opportunities there to develop sort of machine learning program to fill those gaps in the microscale data because it is quite limited. It's not something that most regions collect, but we know it's quite important in terms of different features along individual block faces and streetscapes. So it's definitely something that we're looking at.
Great question.
Okay, thanks. Next question, is there a plan to build a tool for all of Canada similar to those available in the US?
Well, we certainly are interested in exploring that further. At this point in time, I don't think we have a real complete answer to that question. Nothing is concrete in place yet, but maybe this discussion will lead in that direction and other discussions that we're having. Certainly, seems like Canada is poised for something like this, and scenario planning is really the method that's being used in the planning arena. We're really bridging, completely different sectors and disciplines. On the health side, there's not a lot of awareness of scenario planning yet. This is really a great step forward just for scenario planning itself to be introduced more broadly. Obviously, simulation tools have been around, but the extent to which they're being used to inform decision-making is really increasing rapidly. So I think there hopefully will be.
Okay, great, thanks. Just one last question. Can you speak to how your work does or does not relate to the NCCEH tool in California? Any thoughts on this online tool?
Sure. No presentation on scenario planning would be complete without a question about IPHAM. So it comes in at the end. Yes, so IPHAM is a very different approach. These two tools are not at all, they're doing different things. Although they're both predicting health outcomes, we start from the physical environment and predict physical activity and behavior, and then link it directly with observed outcomes. IPHAM uses a very different approach, starts with actually, usually my understanding, and we've looked at a lot of IPHAM projects, a predicted amount of physical activity or active transportation. that might result from different scenarios with perhaps in a regional transportation planning process. So it starts with an understood amount of physical activity and uses global burden of disease to predict a large body of evidence, and then generalize to a geography. We start with the data from the geography and actually work with that data to predict we have more what's on the left. If you remember my graphic showing all those environmental predictors, we're actually painting places or designing physical decisions about how places will be built. Very different approach. So that's my short answer. I hope it was short enough, but they're completely different frameworks. And also our tool is much more spatially resolute. So if you want to apply it to EJ questions, for example, that we did with Christine, we have to be able to drill down to the local area. And our tool, at least historically, has been more spatially precise to allow us to know where poverty exists and where it doesn't. Thank you.
Thank you. So we're at time. And I just want to say thank you to our speakers, Eric, Larry, and Christine for the excellent presentation and answers, and to everyone else for joining us today. We hope you found this webinar to be useful and inspiring for your work. And I've added a link to the evaluation survey in the chat box. Please fill it out to help us improve our future webinars. And we will post the webinar recording and the slides on the NCCEH website later this week, and we will share it with you all. Thank you, everyone, and have a great rest of your week.